Hi viewers, I am Dr. Mohanakrishnan, consultant pulmonologist and sleep specialist. So today we are going to discuss a very important topic, that is sleep. First of all, sleep is not a luxury, it is essential. So we all know that when a child comes to earth, it sleeps almost the entire day. When it grows into an adult, as usual, because of the lifestyle changes and the work related issues, the sleeping duration eventually comes down. But there is amount of sleep which is definitely required for the body to fine tune the body health as well as to repair ourselves and make a betterment for the body. We need a good amount of sleep. So that's what I'm going to discuss with you all today. So what is sleep? Sleep is the thing which needs essentially in the night time for most of us, at least of 6 hours of uninterrupted sleep, which is very vital to make sure the body cleanses itself. All the repair mechanism happens during the sleep. The body is at rest, but the brain and heart and other important organs are not at the rest. So the night things only helps to kick out the dust thing, unnecessary healthy issues from the body, to clear the junks as well as to keep the body healthy. The sleep is very vital. But what's happening nowadays? Because of the rapid growth, rapid urbanization, as well as with our daily activities and nightlife, and because of the change in cultures, after the use of more of mobile phones, the sleep is diminishing day by day for the entire age, of all the ages. We are seeing patients right from older age group of more than 60 years, 70 years suffering from a problem called insomnia, no sleep. So we are not getting any sleep. So we just see the phone, we hear some songs and we are not getting any sleep. This is continuing for many years, or we get sleep only after taking drugs. This is a story for elders. But there are some generation where we call it as Gen Z or millennials or younger generation, where they also suffer from sleeplessness because of various changes in the lifestyle. We have a lifestyle where we spend most of the time as a night outs, or eat unhealthy foods, or more amount of junks in the night, or our health practices, or our social issues which is bothering us, or our addiction mostly towards the phone and television set in the night is not making us to sleep properly. So what are the problems we are facing? See, our body needs rest. The rest should be continuous. It should be uninterrupted. At least 4 to 6 hours of sleep is very vital, because without sleep we can't never function properly. If you have a person who tells you that he can work continuously 24 hours without having any sleep for 2 to 3 days, definitely the potency as well as the caliber of work or his nature or his growth, his style of work will come down in the subsequent days, because he can't get enough sleep. So this kind of sleep, we are taking it very lightly. So what are the problems is happening? See, we have a hormone called melatonin which synthesizes in our brain, which makes us to sleep in the night. You remember our parents or elders or grandparents, whoever were there in the villages earlier, they do go to bed at evening 8 o'clock, 6 o'clock when it gets darker. And they wake up from the bed very early morning by 4:35 when the sun arrives. This is not a routine alarm clock we are having. It is an indigenous clock called biological clock. So we call it a circadian rhythm. That biological clock is disturbed nowadays because of our activities as well as our rapid urbanization and other issues we are facing right now. So this melatonin is a simple hormone which gives us a signal to the brain that person has to sleep. But if you see a cell phone very close to your eyes, the blue light coming from the cell phone, or if you're seeing TV inside your bedroom and sleeping, now FIFA is going, World Cup is going, so this kind of thing can happen for shorter time. But there are certain population who see movies in the night, who watch web series in the night, who sits in the bed and watches TV all together in the night and they fall asleep by themselves. That's a wrong practice, because nowadays all of the homes has got LED television. The blue light directly goes to our eyes, signals to the brain that melatonin should not come out. The person is active, so don't secrete the melatonin. So he or she will be active only. So he or she will feel she is not getting sleep, so they want to further see the phone or further see the TV, indirectly affecting their mental health as well as the physical health. So that has to be cut. If you are not getting sleep, you can go to your living room, sit in the hall, watch the TV or watch the phone and come back and then switch all your lights and sleep. So that's a more important thing. At the same time, nowadays the culture of night outs and working in the gym in the nights. So most of the young people working in the day come to hit the gym in the night, do heavy exercise, they go to bed. But sometimes they won't feel sleepy because they feel more active. That is because of the exercise. Generally exercise we recommend them to avoid, especially during the bedtime. If possible, at least 2 hours before the bedtime. Next, the coffee styles. So now we are taking coffee like anything, because previously we had coffee shots only in the morning and the evening. But after the advent of cafes, we are taking coffees regularly, cold coffee or hot coffee or any kind of thing which tea or coffee which we take after 6 p.m. in the night can keep our brain more stimulant. It's called as sharper. It won't make us to sleep. So that is also a simple lifestyle changes we tell for the patient to avoid tea, coffee after 5 p.m. At the same time, switch off your phone or reduce your phone light, keep it in the silent mode, or keep the phone aside, don't keep it near and watch the videos. Don't see TVs in your bedroom. If you're not feeling sleepy, get out of the bed, just walk for 10-15 minutes inside your room, and then you can sit idle for some time. Then if you get sleep, come and sleep in the bed. So don't keep on moving in the bed without sleep. So this problem which we are facing nowadays in the longer scale, because insomnia is the one which is the largest sleep disorder in the medical field. Most of the patients, irrespective of age group, are developing this problem. So in this scenario, I want to tell you that avoid coffee, tea after 6 p.m. Avoid going to watching TV in the bedroom. Avoid using your cell phone closer to eyes. If you're not getting enough sleep, just take some 15 minutes or 10 to 20 minutes of walk inside your room and then try to get sleep. Don't take tablets as much as you want before sleep. Consult your doctor always. At the same time, change your lifestyle practices. So this helps us to adapt more so that we get enough sleep and uninterrupted sleep. So that that can either help us to repair our body as well as give us a faster, better relief and good amount of more energy in the daytime to us. At the same time, we have nowadays the trend is that most of the children are settling in abroad or working in abroad. The parents are waiting for the phone call in the night. So the various time zone level, most of the patients keep more awakened in the night for the calls to discuss with them. That also can be fine-tuned. Make sure the parents waiting in our Indian Standard Time to go to bed before at least 11 o'clock so that it can be made in a suitable manner for them also. At the same time, if you go, the condition called jet lag, which all might be knowing, if you travel for the different time zone, we might be landing up in a place where it's night over there, but it's generally a daytime in Indian scenario where we'll not get adapted to the lifestyle there. But this jet lag also can be handled efficiently. We can have some kind of pre-jet lag sessions like sleeping, changing your sleep routine just few days before the sleep. If you're going to settle in abroad or going for a longer vacation, to avoid this jet lag issue, you can change your sleep timing earlier before taking the flight also. You can take this melatonin supplements or keeping up yourself wake alerts. The medicines are available to fine-tune your jet lag. So these are the ways which you can manage the insomnia properly. The most next important thing is what the society is facing, what is causing humongous problem to our internal body system like heart and brain, cause for the young age stroke, young age attack. Patients went to bed, died in the bed. Went to bed, morning he developed a stroke. Early morning symptoms, early morning rush up to the emergencies. Most of the thing happening in the sleep is because of a condition which we call as obstructive sleep apnea, which is OSA in medical term. You might be wondering what is OSA. In simple term, in colloquial term, is nothing but the vigorous snoring. If a patient is having a snoring problem, it can be a mild snoring or a heavy snoring disturbing the partner. See, you might be suffering from snoring, but you might deny it or you might not be aware of it because during sleep you might not know that. But your partner or person who is sharing your room will be telling you that you are snoring a lot. Or your wife can or your husband can tell you are snoring a lot compared to the previous years. Nowadays your snoring sound is very high. The decibel high, I can't sleep with you. So nowadays we are seeing patients where the partner sleep in a different room, patient will sleep in one room because of the snoring per se. They are separated from the family in the same home because of snoring issue. So can we take the snoring lightly? We can take it lightly when we have a very vigorous, tight, strenuous job. That day we can have more amount of snoring possible. If a patient is having very tired because of travel, he can have a very deep snoring. That is possible. If the snoring is continuous and it is very high, disturbing the others or causing trouble to yourself, sometimes you can itself wake up hearing your own sound. The simple thing, we ask the patient whether the patient is having any dry mouth when he wakes up, because the snoring itself will cause dryness of the mouth. So this simple snoring, which we see as a family issue, we take it very lightly. We tell my father is a snorer, My grandfather is a snorer. My generation, everybody snores. Nobody complains in the family. Why you are taking it seriously? Just relax, just chill. That is not an issue because snoring per se, if it is untreated, it can lead to severe catastrophic conditions, which I am going to tell you now. It might not be, this video is just to give you an idea, clarity and awareness about how a simple snoring can lead to a significant problem, health risk in your life. See, if a patient or a woman or men snores, what is happening inside the body? There's a choking happening in the upper part. The tongue is falling and closing your air pipe. There's no way to breathe out or breathe in. So air is not going inside, air is not going outside. So patient, what happens? When the air is not going inside, your brain and heart, which require oxygen, will not get enough oxygen. So brain will become panic, it will wake you up. So you might be noticing some kind of sudden jerk in the night, some kind of movement in the night, rolling over, or something for the washroom at least you wake up. Because the brain will send a signal that you have to wake up, otherwise the choking will be more and you cannot breathe henceforth. So once you wake up, the choking will be relieved. Then you will take some water because you are having so dry nose, and again you will sleep. Because of repeating waking up, sleeping, sometimes this wake up will not be more pronounced. You might not itself know. In medically we call it as arousals. So we have kind of micro arousals. Suddenly some patient will sleep. Simple sound can awake you. You will not be in a deep sleep. But if you ask the person who sleeps next to you, he might be noticing you are sleeping with a good sound. It's not a sound sleep. Making sounds in sleep is not a sound sleep. That you should understand first. So what it will do? So night you will not get enough oxygen. So brain will ask you to sleep in the daytime. Once you get up from the bed, you will feel very tired. You cannot have energy to work. You will feel, despite of 8 hours of sleep, you will feel very tired. If you are sitting idle, you will sleep. If you are watching TV, you might sleep. If you are driving, you might sleep. So this kind of signs or warning from the brain that you have to see a specialist immediately. Because this oversleeping will make the patient to worry because the oxygen is not going inside, the brain will not get enough oxygen, heart will not get enough oxygen. Imagine two important person is not getting, how the muscles will get. You will feel very tired. So all the mechanism, sugars will not be controlled. The brain will become angry, your BP will rise, BP will not be controlled. If it's happening daily, if it's unnoticed or not taken proper treatment, it will lead to problems, significant post to brain in the form of stroke, heart attacks, change in heart rhythms, high sugar, high BP despite the control. And more importantly, the main sleep is to reduce your fat, to burn your cholesterol. The motto of brain is to change your fat into glucose. That will not happen. So your fat will keep on accumulating, the weight gain will be there. So weight gain will be there, you will sleep, snoring will be there, oxygen will not go affect the body, again weight gain will be there, it will be a cycle which eventually poses a very severe, high healthy risk for the patient. So this is called obstructive sleep apnea. Simply with the help of simple score, we can identify whether you are suffering from this or not. To know about the quantum of disease, we have done a sleep study. With the sleep study, after identifying the problem, definitely it can be taken care of and make the patient have a very good sleep, make the partner also have a very good uninterrupted sleep. So kindly pass this message to persons who are suffering from sleep related issues. Thank you.